Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration.
Hi, I'm Dr. Wooddell from Davidsonville, Maryland, and I'd like to share with you in a practice inspiration some simple photos and a use of a consultation PowerPoint that can really be a program in your practice for changing productivity and excellence in the work you do. I'd like to introduce Mark to you. Mark came into my office and said, my wife would like me to have a nicer smile. And so the question I pose is when someone comes in like that is, where do you start? Some people look at certain things or whatever. What I want to propose here is that we're going to start with taking some photographs. And the photographs, 5 to 7 photographs, but you'll have the facial photograph with the lip at repose and in full smile. Dentofacial, where you're drawing a little closer, and you're going to get lip at rest and full smile, and then retract the lips and get a teeth apart view, because we're going to use these photos and we're going to insert them in a custom PowerPoint that is designed to go through an aesthetic checklist that will lead you point by point to making critical aesthetic decisions to help make sure that your dental decisions match the face. So the photos go in, and it allows you, the photos go in behind the lines and you adjust the lines, and you're going to look at facial symmetry, facial thirds, you get to see the midline, lip at rest, how much tooth is exposed, all these questions you answer throughout the template, because your decision is, do I like where they are or do I need to change them? And we're also going to see the range of motion of the lip, and is it a hypermobile lip or does it not move enough? Can we do anything about that? So we're going to take these judgments of the facial and dentofacial, and then we're going to retract the lips and look at them dentally. But all of these lines we arrange are based on the facial and dentofacial. When we saw Mark's lip at rest, number 8's incisal edge, that distal incisal edge, was a nice youthful look, and he's used to seeing that. So I'm going to decide to keep his incisal edge right there. And we'll look at his papilla height there, is at about 50% of the tooth. And the only decision we have is how far up do we go? And it actually looks like his gingival height of contour would match pretty well. So we have an aesthetic template that we'll go and take and bring that into the photograph and start to develop his aesthetic plan. From that aesthetic plan, we go to a wax-up. The wax-up is completely dictated by the aesthetic plan, and then you can do a mock-up of taking an impression of that wax-up, try it in, and without even scarring the teeth, we can give Mark an idea of what he's going to look like. Well, he saw it and he said, sign me up. This is what I want. And so led by your aesthetic plan, you're able to achieve 4 really attractive veneers, and something as simple as 4 veneers can just uniquely and amazingly change someone's smile. The photo on the left, his pre-op photo, it looks like he doesn't even know how to smile. But look at the eyes of him on the right. He enjoys smiling now, and that's the difference that we make in people's lives. So what I want to share with you now is this protocol that we use in order to make sure that what we plan dentally is aesthetically harmonious with the face. It's called the STEP protocol. We're going to learn the essential photos for this effective consult, and we're going to learn how to use the STEP template, how to put the photos in, and what's the information that we get from that. And then from there, we'll create the aesthetic plan and compose a consultation where we sit and can outline all the issues for the patient that concern them. So to do this, we're going to go through and introduce what the STEP protocol is. It has 5 steps. It's assess, diagnose, analyze, communicate, and implement. And to expand on that, assess means we're going to gather all the data we need to make any decision we need. And that's photos. Photos are consistent. We always take photos, but you may need models, but you'll do your charting, perioprobing, whatever. From that, you're going to make a diagnosis. And you're going to diagnose comprehensively. This is an opportunity to talk about everything with the patient. Following that, you analyze in order to create the aesthetic plan. Once you've created the aesthetic plan, you're going to communicate that plan to the patient. They get to decide what's right for them. You give them options, never box them in. And finally, that insight into what you do allows you to coordinate, coordinate and execute the treatment. So we're going to introduce Gail. Gail came in and says, I want to have a nicer smile, my back teeth are breaking up, and my front teeth are chipping. I really don't like how I look. So where do we start? We start with assess. And we're going to bring her in, we're going to take our photos. In this case, we actually take 7 photos. And because I want to see the occlusal shots, because she says her back teeth are breaking up, so I need a photo of those. But we'll take x-rays, we'll do our charting, and the patient's dismissed. I'll gather this information, and I'm going to make a diagnosis. And the diagnosis for her is in 4 categories. We do aesthetics, function, structure, and biology. And we color code that to elicit an emotional response from the patient, because they will react to red as severe and yellow as moderate, so they can understand the meaning of the risk that they have. After that, we're going to go to aesthetics, and we're going to determine the 2-dimensional plan using these photos in PowerPoint and the aesthetic template. So we'll take our photos. We have the facial, dentofacial, dental, and the occlusal shots. We're going to take those, and the PowerPoint itself is divided into these sections. There's 3.1 facial, so the first 2 are your facial analysis. And then 3.1, excuse me, that was 3.11. 3.12 is dentofacial, where we're going to look at lip dynamics. And finally, in the dental is where we start to do the design. So here's the aesthetic checklist for developing an aesthetic plan, and we start with facial. And we're going to look at symmetry, midline, incisal edges, facial profile. We go into the template, click the photo icon, and it leads you to where your photos are stored. You click the photos that you want, and it inserts it automatically into the template with the lines already in place. On the left side, you'll see a prompt that will cause you to answer questions about the lower third of her face, her full smile, what's the midline, does she have a canted occlusal plane? This is just like a checklist for a pilot when they're taking off. You're going to look at everything just to make sure and go yes or no. Do I like it or do I not? Subsequently, we do dentofacial. We look at lip at rest and full smile. Lip at rest, we're interested to see, do we see edges of the front teeth when the lip is at rest, and what is age appropriate? Across the top of the slide, you see norms for people. And across the bottom are the questions to be answered. In her, we see that she's 3 to 4 millimeters deficient with a normal lip length and normal lip mobility. So then we go to dental. That's incisal plane, occlusal plane, tooth proportions, gingival height of contour, papilla height, gingival zenith, tooth color, tooth shape, anything we want to change here. We click the teeth apart photo and insert it, and we see that the lines are already in place. You just have to learn to move them, match the occlusal plane, move the midline, judge from the facial and dentofacial views. The only thing we really have to decide here now is the gingival height of contour, because we've not been able to see them because she doesn't have full range of motion of her lip. So what we did in order to do that, so we've set these parameters. So we go to our IDEA dental mold guide. This is a digital mold guide. These teeth have been created in the golden proportion using denture teeth as a guideline, but we select what we feel is appropriate for the patient, highlight that, copy paste it, and bring it in, and you can individually customize each shape to the tooth. We increase the size to the gingival height of contour, we match the central incisors. Gail said she did not want to have a diastema between her teeth, and so we go and customize it and individualize it and see where the design leads us. What you really start to see, and this is the power of using this, you get to see the discrepancy between reality and the desired. That degree of discrepancy is an indicator of the range, the scope of treatment that you're going to be involving with the patient. So if the patient comes in with a consult, a few photographs, get to this point, you're getting right to the heart of the matter to say, ma'am or sir, these are going to require some type of porcelain ceramic restorations, and immediately the patient will say, okay, or maybe I'm not interested. So with just a few photographs, you've efficiently got to some decision points where you engage the patient. That's the power and efficiency of using this. So we have our aesthetic design here, and we go and do the same for the lower. We have the lower template comes in, and you do your lower design, and you see what's the discrepancy in the sizes, and you're able to have that consultation with the patient. Say, this is what's going to be involved in doing a reconstruction of your mouth. She has broken back teeth, the teeth are cracked. Really, it's a full upper arch of restorations in the lower anterior teeth. So finally, you look at function and structure in the template by using the last three portions of the consultation template. You're looking at the occlusal pictures, and that's where you find that, yes, you have fractured teeth, you've got large amalgams, things are breaking. And you're looking at the structure and biologic issues between that and the x-rays, so you can formulate your opinions of what's going to be necessary for a patient like Gail. And that's where the other powerful aspect of using this template is communication. People can get lost in words, but the visuals are extremely powerful with the patient. So you lay out, here's the consultation laid out completely. They can see the logical progression of why you're recommending what you're recommending all the way through. And so when they can understand and own their problems, they're more willing to accept a solution. You can also, there's elements of Adobe Photoshop built in PowerPoint 2010 or later, where you can actually put the lips over or put it in the face, give the patient an idea of the fullness and the change that can have this in the smile. I like this because it's more of an artistic rendering rather than copy-pasting a smile in there. People will tend to marry that, but they know that this is an artistic rendering. So here's Gail finished. She said, yeah, that's what I want to do. There's before and there's after. And only through proper planning from the face in can we design restorations that belong with the face. So the values of using STEP, it's systematic, it's efficient, it's predictable. Look at the framework it gives you for making decisions just by using that checklist. Communication with the patient is powerful, and it's great for members of your interdisciplinary team and with your dental laboratory. The skills you need to do this is you need to be able to perform a comprehensive exam. There's precision dental photography. You need to take these photos correctly because we're making diagnostic decisions that involve the time and talent and treasure of our patients. The photographs have to come in lens parallel to the face, coming in the level of the occlusal plane. You need to be able to use PowerPoint, but we've made it really easy for you. The photos go right in. You just need to know how to manipulate the lines. All of the decision tree is in there. You just have to check it off. There's a completed STEP template as we present it to the patient. So to continue the skills, you need to, it's critical that you understand the aesthetic parameters. Why are you putting the lines where you're putting them? And what are the decisions you go in that? When you master that, become the master of the case. The patient senses your confidence, and when they know you're confident, then they will select you to do their treatment. So, simple photos and a consultation PowerPoint, a program for productivity. Our patients present with problems that represent change. Therefore, it's essential to have a system to recognize and analyze and treat these changes that facilitates the restoration of the patient to lasting aesthetic and functional health. Thank you.